This is the Emergency Medical Minute, sponsored by Health One.
So I was going to take a couple of minutes to talk about dental trauma, specifically sort of a way to think about it in terms of a classification schema, and then use that as a springboard about the different strategies that we do to temporize the care until the patient can get definitive care, generally through a dentist. So what are the types of dental trauma that you guys have seen come through the emergency room? So trauma. So broken tooth, right?
Accidents, busted in like second maxillary.
Right. So either a tooth that gets avulsed or luxation is the term where it's loose. So those are the broad categories that I'm going to talk about, which are dental fractures. Okay, which there's going to be 3 that we talk about, depending on the extent of the injury. And then avulsion is when the tooth gets knocked out, and luxation is when the tooth is loose. And with each of those, we'll talk about, how we characterize it, how we initiate treatment, and what the eventual disposition is. So sort of systematically, in terms of a fracture, there is a classification system that's sort of time-honored in the emergency room. It's called the Ellis Classification. It's intuitive in the sense that there's 3 layers of teeth. The outer layer is called the enamel. The inner layer, where the neurovascular bundle is called the pulp, and in between is the dentin. Okay, so enamel is what color? White. Do you know what color dentin is? Yellowish. Yeah. And then the pulp? Reddish, pinkish. Right. So when you look at the tooth, if you look here, if it's just the enamel, the tooth stays white. If it's enamel and dentin, you can't really see that well, but you start to see some yellowish. And then if there's exposed pulp, you can see how that's pink. So in general, if it's just enamel, we don't need to do anything. We just refer to the dentist. It's generally cosmetic. They either file it down, or if it's significant enough, they can build up on that tooth. But it has no implications for our care because the patient's not at risk for losing that tooth or getting a complicating infection. When it involves the dentin, or if there's exposed pulp especially, that tooth has to be covered. And the reason why you have to do that is because even if it just involves the dentin, there's these little capillary tubules that allow bacteria to get to the pulp. And if you get an infection in the pulp, then you need a root canal. Okay? So it makes a really big difference. Do you guys know how we treat that in the emergency room? So I have it here. It's called Dycal. It's calcium hydroxide. It has 2 tubes. Okay? How many have been involved in sort of a tooth repair like that? Yeah. So basically 1-to-1, you mix it on the paper. Generally sets in a few minutes. One thing that ends up happening, I would say inevitably, is it's super messy. So one of the tricks of the trade that I brought here is you can actually, you take the stopper out of a syringe, you load it into the syringe, and with an angiocath without the needle, right, like an 18 gauge, then you can just dispense it in a real neat way onto the tooth, okay? So that's trick of the trade 1.
It's like
What's that?
nothing.
As far as avulsions, the thing to remember there is that for every minute the tooth is out that you don't put it in, the risk of permanent tooth loss is 1%. So if you put it in immediately, you basically salvage the tooth. Usually when they come into the ER, 20-30 minutes in, you're already at like 70%. And if they wait an hour, then you're looking at an unsalvageable tooth. So it is a true dental emergency. I'll talk a little bit about luxation, but luxation is just a loose tooth. The reason why I'll sort of categorize both of those together is, do you know the definitive treatment or the temporizing treatment that we do in the emergency room for a tooth that we've reimplanted or a tooth that's loose where we want to stabilize it? So it's similar conceptually, I'd say, to Dycal. Dycal, but it's called Copac. It comes 2 tubes that you mix together in a 1-to-1, and generally you create like a little worm, and you put it along the teeth. Right? Have you guys seen that or no? No. So again, that tends to be a little bit tricky, and one trick of the trade there is the teeth have to be completely dry. So, the thing that I use is oxygen tubing to desiccate the teeth, and then you can place it right on there, and it acts as a brace. Dentists would usually take that down and put on like an arch bar, but as a temporizing measure, it can make a really big difference. So hopefully that gives you sort of a perspective on dental trauma, all the way from fractures to avulsions to luxations, and a little bit about what we do in terms of the treatments, which are Dycal and Copac, and some of the tricks of the trade that you guys can gently suggest to the PA or the doc who's mucking around with the tooth. All right. Any questions for me?
Thank you.
Okay, yeah, sure.
We are on a quest to provide the world with free medical education. Please help us out by rating us on iTunes, following us on social media, and subscribing to our newsletter at emergencymedicalminute.com.